When I originally matched into plastic surgery, I was telling my then, of course, otolaryngology colleagues, and some were certainly congratulatory. Others, more senior attending staff, were feeling a little bit different, let's just say. And so one particular senior attending who had been one of the founding members of the Facial Plastic Surgery Academy or board basically said, well, congratulations. Now we'll never see you again. But others also said, congratulations too, that now you'll be hated by both fields.
Welcome back to the DIEP End podcast. Today we are honored to welcome Dr. Samuel Lin. Dr. Lin serves as the Director of Aesthetic Surgery at BIDMC, and he is Chief of Plastic Surgery at Beth Israel Deaconess Hospital Needham. He's on faculty at Harvard Medical School. He's also Executive Director of the Harvard Surgical Program and Innovation, and he's held leadership roles and program director roles in both the plastic surgery training program and amongst the Harvard medical faculty physicians at BIDMC and Massachusetts Eye and Ear. He is board certified in both plastic surgery and otolaryngology uniquely. Dr. Samuel Lin has built a truly unique career that blends aesthetics, reconstruction, innovation, and education at the highest level. Since beginning practice in Boston, he has become one of the most recognized voices in our specialty. We'll talk about his path through dual training, how cross-disciplinary experience sharpens surgical judgment, his vision for the future of plastic surgery, and what it means to lead one of the most influential journals in the world as editor-in-chief of plastic and reconstructive surgery. Dr. Lin, welcome to the DIEP End podcast.
Thank you for joining us, Dr. Lin, on the DIEP End podcast. We're so excited to have you. We've had so many listeners reach out and say, when are you doing Dr. Lin? So I'm happy that we were able to get it on the schedule. But we'd like to start off, like as we were talking before we started the recording, back to the beginning, just so our listeners can get to know you as a person and find out your path and what brought you into medicine and what brought you into plastic surgery, because I know you've had a little bit of a different path.
Sure. Well, first, thanks so much, Saeed, Hank, for spending time with me on an afternoon, busy day that everyone's had. So it's really great being on your podcast. I really appreciate it. And so I think from the beginning, we all have unique paths. I don't think anyone really, for sure myself, didn't choose a path and know what I was going to do 10 years from the beginning in the future looking forward. But indeed, going way back, I think from college and thinking about medicine, it was clearly around trying to find a way to uniquely help people. And that sort of mantra has, of course, grown over time as we've refined it and learned from your experiences and have new experiences over time. So that's all sort of what it was from the beginning. And I think in medicine, many of us are conservative to a degree, wanting things that are stable. And so that I was also in that mindset. So going into medicine sort of fit all those things. I think choosing a field, initially I went into otolaryngology, head and neck surgery, and it really was around knowing a lot about a certain area. So in that case, it was really the head and neck. And the head and neck anatomy, of course, is a very intricate anatomic space in the body. I think, things such as the temporal bone, all the little nerves, vessels that travel in that bone probably is the most complex in the body. And so really understanding that depth of anatomy and microanatomy really piqued my interest. Over time, I started to become interested in some of the more open cases for sure. And I was really interested in learning more about cleft surgery, actually, and head and neck reconstruction on the micro side. And so that's what really drove me towards plastic surgery training, which luckily was able to continue also at my home institution at Northwestern. Over time, also, I wanted to delve into even more complex stuff. So I ended up doing a fellowship at MD Anderson in time as well. And if you were to ask me as a first, second year medical student that I'd be training for 9 years, I would have thought you've been crazy. But like I tell my residents and students, you never regret your training. And so there it was 9 years later. And looking back, I think I would have done it the same way. I learned things from both fields, folks and friends and colleagues from both fields for sure. Been able to take away things from both fields to grow and as a person and a surgeon, and then of course ultimately apply it to research and my clinical practice. So I feel like I, at this point, have a good balance of what I can do. I feel like I am using both sets of skills or all my training. Obviously, I don't do the breadth of either field, and that's of course what it is. But you just want to try to strike a balance when you're doing your practice and thinking about things over time.
We have microsurgery interviews today, and we had an applicant who's ENT trained, and I mentioned your name, but it must have been nice to have that overlap with Matt Hanasono, who's also kind of has your training background as well. It's one thing, I did the independent residency as well, and it's one thing to be an independent resident. I feel like there's a steep learning curve with that. But to take it one step further and to have that ENT background, I imagine there's like incredible challenges. What do you think were like the biggest challenges?
Yeah, thank you. I said this once. I had this quote this last PSTM meeting, and it was sort of the intersection of plastic surgery and other fields. And Dr. Hollenbeck asked me to sort of speak on my thoughts on ENT and working together in the future, perhaps, in the future of that collaboration. And so I'll go back to that slide sort of quote, which was when I originally matched into plastic surgery, I was telling my then, of course, otolaryngology colleagues, and some were certainly congratulatory. Others, more senior attending staff, were feeling a little bit different, let's just say. And so one particular senior attending who had been one of the founding members of the Facial Plastic Surgery Academy or board basically said, well, congratulations. Now we'll never see you again, basically, for the meetings, which was mostly true. Basically, only plastic surgery meetings. I rarely go to facial plastic surgery meetings, or certainly not ENT meetings at this point. But I did in the beginning. But there's a meeting every weekend you can really kind of go to. So I go when I'm asked, and so on. But others also said, congratulations too, that now you'll be hated by both fields. So
Yeah,
I wasn't
exactly.
sure that was going to be the case. And certainly you carve your own path and do what you think. But certainly there's been crossover from neurosurgical plastic surgeons, orthopedic plastic surgeons, ophthalmologic plastic surgeons. And these are
Yes,
prominent people that we all know, household names, actually at your institution as well, who have carved their way and done, I think,
exactly.
pretty well. And to that end, that background really helps in terms of patient care, of cross-training residents and students. So it gets beyond the titles and the backgrounds and just gets down to patient care, I think. And I think these days, at least in the ENT plastic surgery world, there's going to be, of course, history with folks and hurt feelings in the past and things that may have been said or what have you. But I think if we can all try to keep moving forward, these differences hopefully will continue to change, but I know they may exist on some level in certain locations. But clearly, I think if we can just rise above that and keep going, I think that's great.
Yeah, I think especially with plastic surgery, it's almost a blessing and a curse that we don't really have any boundaries because then we find ourselves in a lot of different territories. But it's interesting over the years, as you I think were alluding to, there's oculoplastics, orthoplastics, now there's neuroplastics, and it's turning into a thing where we're going to have to be a lot more collaborative. And I think it's a good thing. But I'm curious, you do have a background in ENT otolaryngology. How does that change how you approach your plastic surgery? Or things that would be traditionally plastic surgery, how have you brought that background into your
Yeah,
everyday?
sure. I think we all think of ourselves as having some sort of purpose based on what we can contribute to a team or and think in our case is academic medicine teaching. And I think just from specifically talking about one area, which is rhinoplasty, if you
Yes,
look broadly speaking, our trainees and those who go into practice, I think more people are more hungry to see more rhinoplasty, at least to just
Yeah.
focus on that. And at least for me, it's a one-man band here, but I think part of my purpose is trying to bring this cross training to our trainees and sort of deliver what I think is safe and to be able to train people to go into practice and practice safe rhinoplasty. I think that's really what I'm trying to do. It's, not going to be any economy of scale, but I think plastic surgeons should be able to be comfortable. And as folks have said, as Ron Daniel had said, if you haven't practiced or done a rhinoplasty in I think he said 7 years, but certainly within the first number of years, you're never going to do rhinoplasty. So I think we don't want to lose it. So
Yeah.
I think it's important that we keep thinking about it.
Yeah.
I think that what's interesting is that you play a role in training the aesthetic fellow in Boston. Is that right as well?
At
Both
our
microsurgery and aesthetics.
Yeah, I basically primarily they had been co-directing this aesthetic fellowship with Dr. Slavin for a number of years. He's starting to transition a little bit now, but yes, we have an aesthetic fellowship. I've been involved also on the microsurgery side, of course, and over time less so these days, but yes, basically sort of a broad sort of front.
You know, one thing that I'd love to ask you is we have our residents here rotate with facial plastics, a faculty member who does a lot of rhinoplasties. And do you think that your ENT background kind of gives you a unique perspective when approaching those cases?
I mean, I like to think so. I do a lot of combination cases, just to be frank. So I do a lot of revision cases, primary cases, but also primarily combination cases. What I mean by that are the function and aesthetic components. Who knew? I certainly didn't when I was training that there were this many patients who could have fit that bill of wanting to function better, breathe better, and also look different, of course. No one tells you that. I think different practice models across the country, the world, sometimes it sort of divvies up the cosmetic side on the plastic surgery side, the functional part on the ENT side. But I think this extends to everywhere on the body, depending on no matter what kind of surgery you do. I think that you want to be able to get yourself out of trouble. So I want to be able to address problems, whatever it might be. I don't want to have to send out things of issues, complications patients have had. You just want to be, buck stops here kind of person. And that's been my sort of thought. That was primarily for the residents out there, my motivation to do a microsurgery fellowship. Frankly, at that point, trained for 8 years, clearly could have gone into practice, had been looking into practice opportunities at that point. But I just wanted to see some additional cases and be involved in just some really complex cases. And that's what I saw in Houston. And you can see those kinds of cases everywhere in the different microsurgery fellowships and centers, of course, in the country and certainly in the world. There's some very prominent ones around the world, of course, but I think that gives you at least some confidence and courage to be able to understand how to potentially get yourself out of trouble. And that's ultimately, I think, what it all comes down to is being able to be that person to address problems and come up with solutions.
We were talking about it at a dinner the other night, actually. What was it, 2 nights ago, with a bunch of craniofacial surgeons, but also aesthetic surgeons, rhinoplasty surgeons, about the influence. And Hank and I have talked about this before, about the influence of AI, a patient coming into the clinic and saying, "This is the nose that I want," and kind of an AI generated photo of the absolute perfect nose. Have you seen that at all in your practice? And how do you kind of deal with the other thing we've talked about a lot, particularly on the aesthetic side with surgeons whose focus is purely aesthetic surgery, is the influence of social media on what patients' expectations are now and what their appreciation for what you do, their post-operative outcomes. Are you seeing that at all in your practice? And how do you sort of deal with that?
Yeah, I think we all see that to some degree. If it's not the nose or the face, it's the breast, body,
Yeah.
whatever you pick your area. So that's been ubiquitous, I think, for a number of years now. It's, of course, it comes in the form of social media. A couple thoughts on that. I think that in the world that there are certainly patient aesthetic sort of ideals, there are surgeon aesthetic ideals, right? So you'll be potentially seeing these sort of things presented in abstract form in meetings, but the degree of angulation or rotation of a nasal tip ideal varies among rhinoplasty surgeons as well. So I think that has to all be factored into what people are bringing in terms of pictures. Now, in terms of simulations and just pictures that people bring in, obviously folks use them as differently. They are, of course, not a guarantee of a person's result, but it's a tool for what the patient's actually thinking about, how realistic their goals might be, and so on. Some people use morphing, some people use zero morphing at all. I rely on patient photos, so before and afters primarily. And what I specifically do is showing patients first getting an understanding of what they're interested in, of course, what they're interested in changing, their top priorities, of course. And then I try to show folks individual sets of images that reflect what each of those maneuvers is. So stress the fact that when you see things on social media, before and afters, 20 things could have happened before and after. The lighting is different, the makeup's different. You have no idea really what's going on. So it's really hard to judge and see what's going on in that. So to be beware and be cautious about that. The other thing I would say is there are so many lateral profiles out there, but not enough frontal views. I always actually tell patients that, we're not hammerhead sharks. We're not looking at ourselves that way. Clearly, we're looking at ourselves in the front and on the sides, and those are the most important views, really. So
Yeah.
that's really everyone has an individual way of handling it, but in broad strokes, that's what I think. Of course, in the New England area, as you guys are too, in New England, people are conservative by nature, and I'd say the degree of which nasal tip rotation is, or at least what I see in my practice, I think is very different than what I see at rhinoplasty meetings, to be quite honest.
Yeah.
That's just, and I've said that before. It's just, but folks who want really projected noses can get that. They just have to understand what that means from all views.
Yeah.
Yeah.
Something that I wanted to ask you about is that you've built a practice that kind of spans both ends of the spectrum, which is microsurgery and aesthetics. And as a resident, there's a lot of anxiety, a lot of deciding on which path they're going to take and how do you choose. But
Yes.
you're someone as a role model to many as a proof of concept that you can kind of build a practice doing both. But I'm curious how you balance those. And is it a conscious decision of a percentage, or is it how the weeks land and who you book, or what comes in the door?
Yeah, I think training wise, going into practice after graduating residency, one, I think it's true. I was told by my former chair and program director, Tom Musto at Northwestern, that get busy and get doing something. There are folks that just do a lot of things and just narrow it down over time. There are others who want to just hyper focus right away, and it might take a little time for you to develop that practice that you want. And it's definitely different paths. I chose the former because I wanted that experience. I wanted that experience of doing the crazy cases, moving tissue all over the body, and then focusing over time. I always was doing rhinoplasty or nasal surgery from the very beginning, honestly. And now with that and facial aesthetics, that some of that is focusing
Yeah.
over time, certainly. I still have breast reconstructive patients. I still enjoy doing it. I love taking care of those patients, but practices change over time for sure. But I'm still in the mix. But I think for people who are interested in things, then I think you should go for it. People definitely have mixed practices doing a few things and not just one topic.
Yeah. And if you were to think about your practice, what do you think you would say is my Sam Lynn's contribution to this type of surgery? Is there anything you can pinpoint when it comes to your practice, whether it's rhinoplasties or microsurgery, where you're like, this is what I've really, since day one, really wanted to kind of tackle and perfect, and I'm proud to have thought about it this way?
That's a great question, Saeed. Loaded question. I don't think I've perfected anything, to be quite honest. And I'll allude to kind of what I would say I've thought about over time and practiced over time. Credit to my staff and my training in different places. But I think all the clinical things I've thought about and changed have been incremental in terms of efficiency in microsurgery, just elimination of wasted steps. Clearly, I just talked to you about what I think my role is as an educator now is really trying to combine the function aesthetic components of a nasal surgery or rhinoplasty safely and then doing it day in, day out every week. But I've, and this is maybe not this focus clinically, but I've chosen to, from a research standpoint, focus on the biggest number of patients in terms of change factors. So that's sort of like where my other world is in terms of basic science, biomaterials, things of that nature, to really move the needle in those types of projects. So as a broad stroke, that's sort of my thinking and in a little slice of my world. But I do enjoy trying to innovate across clinical practice, certainly, and patient care efficiencies.
Yeah. So now the sort of the elephant in the room, now that we talked about some clinical stuff, is that Congratulations on your recently new appointment. What an incredible, 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 incredible honor to follow such unbelievable legacies in our specialty, in research, in education, in academics. And you're so incredibly deserving of it. First off, did you ever see yourself in this position at any point in your life? And then how does it feel to be the editor in chief of the Plastic and Reconstructive Surgery Journal?
Thank you. It is sort of surreal for sure. I'm still getting used to it. I play well into it at this point. I've been in this role since January 9th. One component I really always bring up is the fact that Dr. Bob Goldwyn, of course, who was editor for 25 years, it'll never be like that again, but for 25 years, was the division chair of Beth Israel Hospital. So I spent a year, we all did, when I started, when I was my first year of practice, he was still attending conference every Tuesday. And so I spent some time with him on a weekly basis then. But to be able to, have that come back to our hospital was kind of special. So
Very
definitely,
special.
definitely not planned. And it's sort of one of those things. I really want to give a big thank you to certainly all the members of the search committee, my letter writers, the editors in chief previously, and the board, of course, who gave me that confidence. That was a process in the last fall, bit of the fall, last quarter, and so I'm completely humbled and honored to be the editor, and I think it has as you can imagine, a big responsibility of shepherding these great ideas that come from all you as the authors, and all the folks who review for PRS, which is I truly truly appreciate, and all the passion and the care and dedication out there, and the fact of that everyone cares about the journal. Everyone wants to see it do well, and so that is truly inspirational. I mean, so it is a daily effort for sure. Thinking about the journal, I've unfortunately sorry to say that I've stepped away, of course, from some obligations at this point, committee work and
Yeah, you have to.
things.
Yeah.
I don't feel like it, and I've stepped away from program directorship as well for the residency programs, clearly because I don't think you could fairly say that you could do anything well trying to wear all those hats. So I think it's clearly my charge to do what I can and keep going with the journal and bring it into this world of AI and trying to integrate that for the best situations for the authors, the reviewers, and the staff. So I look forward to that. Thank you.
Yeah.
That's so exciting. And what do you think is like, thinking for the future down the road? Some of the people who are editor in chief had that role for such a long time. And it's hard with such an incredible legacies to follow to think of what can I then do uniquely or contribute in the future myself. And so what do you think when you first knew you had the role, what were you, this is what I want to contribute to in the future? Is there anything that comes to mind in particular?
Yeah, yeah. In the fall, had been really talking about the integration and bringing forth the journal to modernize things. In terms, of course, we're in the modern era, but really, AI it changes every month or even faster. A publishing house and a journal is like a cruise ship. It's a lot of production that goes on. It's not a speedboat going through the water, but I think there are some really great tools that have actually been starting to be implemented in terms of AI. Now, these are things that you may not see always on the front cover or in the pages of the journal, but the things that are slowly starting to help and you know look forward to some developments over the next year or two from the publisher again to help authors and reviewers. And so these are things that I talked a lot about. For one thing, I would definitely like to contribute and bring that in terms of that monetization aspect of the journal. In terms of content, again, it's an international journal. We want to keep pushing the needle in terms of the most relevant clinically practice changing elements and papers and information for folks. And that's what I'm really thinking about and looking at. And we just want to be on the forefront of all topics and being really relevant to the practicing surgeon, either in private practice or academics. And that's how I see what the editor should be doing.
Something else that you pursued was an MBA. I'm curious what made you decide to get an MBA out of all the other things you already pursued, and how has that influenced your practice or your career, how you think about healthcare systems? And then secondly, just do you think more surgeons should pursue like formal training in leadership or business?
Sure. Great question. Thanks. So, when I had started to practice and thinking about research, as I mentioned, I really wanted to think about some things to work on that would affect the broadest number of people, patients. I wanted to work on big things. And so I had started already a number of collaborations in town. We'd written some nice papers, high impact papers and journals. And going along, I wanted to do that degree for two reasons. One was formally trying to learn, actually be trained in entrepreneurship, and MIT Sloan has had that and is known for that. And the second one was just learning about life in general and just personal growth. All these classes, accounting, finance, organizational processes, different classes that are really, when you're in pre-med track and things you're doing in college, you just in medical school, just no time to really learn about how the world works. And those were really the two motivating factors. I sort of held, I think, hopefully true to that throughout the process. I remember in the first 2 weeks of orientation of that program at a classmate of mine was asked me, like, what are you going to do with this degree? And
Yeah.
I said, well, in 20 months, I'm going to have the same job and use these skills to do other things, of course, and build on that. And I just remember this like complete confused look on his face because more than half of a class, an MBA class, basically uses this degree to sort of leverage and go on to the next thing, whatever that thing is, promotionally or in terms of company stuff. But, I just knew that it was going to be helpful regardless from a efficiency standpoint, from a organizational standpoint, just running organizations and groups of people to have those skills. And these are things that you could certainly read. But also in a setting where, and Sloan is it's a general management MBA program. There are programs that have more specialized focus in different aspects of business. But I really, really enjoyed it. It was really, for me at least, one of the most important things I did in my
Wow.
career. I really enjoyed it. We still have I keep in touch. We all keep in touch with all of our classmates. So we have this big, of course, big WhatsApp group from our graduating class, 2015, that we still update. And I know that if there's, and they do the same for me, if there's something I need to know about something, then it's a very short degree of freedom that I can figure out something. And this is in a class cohort of folks who are in the military, who are in Google, who are oil and gas, who are in all parts of the world, and transit, you just name it. And it's just a great network of people. That's just what it is.
You're so
Now,
right.
it's not for everyone. Look, it's expensive. No one's gonna pay for it
Yeah.
except for you,
Mhm.
okay? And prices keep going up, and I would sort of look forward from that and decide if people are deciding whether to do it or not. I would look at the end state and say to yourself, "Why do you want to do this? What do you want to gain from this?" And I'm certainly always happy to have a side conversation with anyone who's thinking about it. So I certainly had a great experience, but I think you want to obviously make sure that investment of time, money, energy is really going to be meaningful. So I would think carefully about indeed what you want to do with it. And life's short, so you should do it. But I certainly promise my family that I'm not doing any more degrees. I'm good. I'm set.
That's fun.
Yeah. I think, it brings me to a point when hearing you talk about your like for what you did, in addition to such a unique background in training, your kind of technical mindset when it comes to aesthetics and microsurgery, you're now a massive leadership role in plastic surgery research and education, the journal. With all of those combined, what do you think is the future of our specialty?
Light question. I think it's really why we all went into plastic surgery. We're going to constantly be under the sort of scrutiny and basically being copied by other fields, other specialties. We teach other fields, and frankly, we welcome other fields to have them learn from us, really through either education or writing. And that's always going to be the case. I think that's just, imitation is flattery, right? So I think for plastic surgery, we just keep needing to be on that leading edge and really the leading edge of all techniques of science. And there's some great science being done out there. We just need to keep pushing the limits and innovating. That's ultimately might sound cliche to say, but that's really what plastic surgery is. I think the truest form of general surgery in this respect that we really have a set of general principles and
Yeah.
we apply those general principles to each and everywhere in the body. And we touch so many fields from reconstruction to aesthetic to certainly lymphedema to migraine surgery. I mean, it's an amazing field. And I don't think there's anything quite like it, really. So I think we just need to keep going and ignoring the noise.
Yeah,
Yeah. And
I've
so,
heard I've heard
go ahead.
Dr. Cerletti say once that plastic surgeons are like the surgeon's surgeon. So I always think about
Yeah.
that. Yeah.
That's true.
Totally. Yeah. And so, with all this in mind, do you think that there's still a role for the independent resident?
Absolutely. Look, there's several of us that went through the independent track. I myself, of course, went through the independent track. I was just at ACAPS, and we have certainly an independent track and an integrated track. If I have anything to say about it, we will continue the independent track. There are no plans of discontinuing the independent track, and it's so important. We want those folks coming in, of course. They've run a service before. They generally speaking, have a different mindset to patient care because they have experience. Like, why, if you haven't decided that you want to go into plastic surgery when you're 18 years old, why should you be penalized for going into another field and not going into it later on? Like, I think it should
Right.
always be there. And I really, truly believe that it's so important that we have that track and always available, but also the ability to have people cross trained, as we've been talking about for the last hour. I think it really is important. Some of the major contributors in our field, many of them have been folks that have trained in other fields. And just that interchange of information, knowledge, I think is a great thing.
I'm incredibly grateful for my independent background and for having this tremendous opportunity to join the plastic surgery world. Before I want Hank to do the couple of rapid fire questions, but I'm always curious about if there's anything you look back in your life, you've accomplished so much, you've done so much that you're like, I wish I could go back and do this differently.
Well, I think we think about not wanting to ever waste time. We always want to be thoughtful in our decisions. And I don't know if there's anything I was saying about training also that I would have done differently. I think you try to be circumspect in every decision point that you have, making things going forward. And, I think things happen how they happened. As I mentioned earlier in the conversation, I never really quite planned any of this, honestly, and you just take one step at a time. And I really think making each day count matters, and not having so much to worry about obviously planning for the future, but really making each day count. I don't feel like I've regret some of these major decisions in terms of training or education. I definitely regret making some bad investments over time, at one point being crypto. So I think that we all make mistakes, but I think the bigger thing is learning from those mistakes and sort of moving on.
Yeah. Well, thank you again, Dr. Lin. This has been incredible. We just have a couple fun rapid fire, quick answer ones that we ask every guest. But one that's more unique to you is if there's one paper that you think every plastic surgeon should read.
Yeah, well, I think there's some landmark papers for sure that I think we all can cite, and I don't know how they fall in terms of the number of citations each had, but I think this goes up there. And certainly part and parcel with nose or nasal surgery is certainly Burgett and Menick's paper. I was just thinking about that because I just spoke with Dr. Menick, who's retired now, a couple of days ago this week, and he remains a reviewer for the journal as well. So I really appreciate it. So I just was speaking to him, but I think that's up there. And certainly
It's
there's an
wonderful.
original paper by Mulliken, of course, categorizations of vascular anomalies. That's up there. I think those are just classic articles that everyone should know a little bit about. But also, I think on the other side is I think just the discussions as we find at meetings. It's really the discussions that are rich. Of course, the paper and the presentations, the abstract presentations or oral presentations are important, but it's also the discussions of what people actually think. So through that, in the past, if you flip through Goldwyn's editorials, he loved to write, some of those
Hmm.
unique perspectives, they're just chock full of really interesting observations about life.
Yeah. And the last two is just what music do you listen to in the OR and what's your favorite surgical instrument?
I tell the folks in the operating room to not put in anything too slow. So it's usually a combination of something that everyone will listen to, today's hits or something. These things, on Spotify, you can listen to anything you
Yeah.
want. So I'm good with most things, honestly.
Yeah.
And favorite instrument, well, in rhinoplasty, I have to say the caudal speculum and a really good freer. That's what I'm always
Nice.
asking for.
The
Amazing.
Freer is that's Sir Letty's instrument for sure. Well, it's so great to think of the future of our journal being in somebody with such a unique training background perspective, MBA, and just passion for research. I have such a love for the journal. Every time I have an ability to contribute to it, it's such a tremendous honor. And, Rod Rourke was one of my top mentors when I initially entered plastic surgery. So really just a huge congratulations to you. You're incredibly deserving of it. And I can speak on behalf of any single person I've talked to, but everyone is so excited about the future. And thank you so much for joining us.
Thanks so much, Saeed, Hank, for inviting me on your awesome, awesome podcast. I really enjoyed this conversation
Thank
as
you.
well. And I look forward to speaking with you again.
Yeah. All right.
Awesome. Thank
Thank you
you.
so much.
Thanks, everyone. Thanks so much.
Thank you for listening to The Deep End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The Deep End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.